So before we get started, I just want to quickly express that the views, opinions, and content we talk about here do not necessarily reflect the official position of the Department of Behavioral Health and Recovery or the Healthcare Authority. So welcome everyone. Again, my name is Eva Lerner. I am a senior program manager with the Corporation for Supportive Housing. I'm on our consulting team, and I have been with CSH since June. I'm based out in New York City, so it is a little after 12:30 here. I know it's bright and early for you all on the West Coast. I'm joined today by my colleague, Marcella McGuire. I will let her introduce herself.
Hey everybody. I lead CSH's Health and Housing work nationwide. I am based out of Philadelphia and have been working with HCA and other great Washington State partners for the last 2 to 3 years on your foundational community supports program. So great to see everybody today.
And our final trainer today is Terry. She will not be joining us today. She will be joining in a future session, but you can see her smiling in this picture, ready to join when her session is up. So just to brief, for some of you who were not on the training last week, and for those who were, a refresher, your team today may include, members of your organization, the executive lead, a program lead, someone who's really sort of responsible for overseeing the ins and outs of the foundational community supports program, a fiscal lead, someone who's responsible likely for revenue generation and developing the budget, and then a quality lead, someone who is responsible for ongoing performance improvement, quality improvement, ensuring that you are meeting the needs and goals of your program participants and continuing to engage in continual quality assurance and quality improvement. For some of you, your smaller organizations, you may have folks who are playing multiple roles. You may have one member represented from the entire organization, and you're going to wear all of these hats, and that's totally okay. We are here to support you in that process and to get you comfortable with all of the different material that you're going to need in order to play these different roles. And of course, the purpose of the Medicaid Academy is really to help you learn how to bill Medicaid for the foundational community supports that you are providing your program participants. We are joined today by Rayanne Orbaum from the Healthcare Authority of Washington State, HCA. They set the policy requirements for foundational community supports and Medicaid across the state of Washington. They are the what, they set the what, they determine what you can cover and what you can bill for, whereas Rayanne's role on the foundational community supports team, they help you with the how. How does your agency develop a plan to bill for foundational community supports? How are you able to actually implement this important program for your participants? And in these slides, which we have shared and will continue to share with you on the SharePoint site that I've emailed about, we have links here for you to actually click and learn more about the state's approach to FCS and Amerigroup, who will be joining us shortly, the implementer of this program as well. And of course, each session will include helpful tips and tools provided by us, your technical assistance team. We would love for you to engage in learning across agencies, so there will be time for Q&A and for conversation and some coaching as well. So just a brief overview of the schedule. Last week, we went over provider enrollment. We provided a brief orientation to foundational community supports and how to get your agency enrolled in the foundational community supports and in Medicaid. Today, it's about getting your participants enrolled and determining whether or not your program participants are eligible for this program. And then in future sessions, we'll go over staffing and budgeting, policies and procedures, documentation and billing, and quality assurance. On October 20th, I just want to flag for you, that's a Thursday, we will be offering an opportunity for Q&A. So we'll be reviewing the content that we discussed in sessions 1 through 3 and giving you an opportunity to ask any questions. For folks who are not able to join the first session, this is a great opportunity for you to come after having reviewed the slides, listen to the recordings. If you have additional questions, you can come to this session and we'll be here to answer those questions. We'll also offer a secondary opportunity for Q&A on November 10th to cover sessions 4 through 6. So just wanted to flag that. And of course, we'll develop an ongoing FAQ for you all. If you have questions that we can't answer, we'll definitely touch base with Amerigroup, with HCA to get those answers to you. So I mentioned the tools and the SharePoint thought drive. HCA is in the process, FCS is in the process of developing a website for which we can store all of these slides, recordings, tools, and materials for your use. Unfortunately, that website is not quite ready yet. And so as an alternative, we are sharing a Corporation for Supportive Housing internal SharePoint site exclusive for your use. In order to gain access to this SharePoint site, you will need to be added to CSH's directory. I have submitted all of your emails to our IT specialist who is adding you to the directory, and you should receive an email from him inviting you to log on, to create a password. This will grant you access to the directory. Once you have access to the directory, I can then invite you to the SharePoint folder. So it's really important that you accept the invitation from our IT director as soon as you receive it so that you can create that password and I can add you to the folder. If you do not receive an email from him, his name is Josh Rucker. If you do not receive an email from him or any other sort of SharePoint, Microsoft, set a password, anything like that by tomorrow, Wednesday afternoon, please email me and we'll make sure to get that taken care of. I see that we have Jacob here now from Amerigroup, which is great. Hopefully your technology is working now, Jacob.
Yes, I apologize for being late. Yes, I am finally here, I think.
No problem. We're
Sound
just
great.
covering the basics. And so the tools that you can expect to receive, I've sent some of them over to you already, and they, again, will be shared in this SharePoint folder, are an eligibility tracker. So this is an opportunity for you to keep track of the participants that you are submitting for FCS coverage, as well as an approvals and denials tracker. And this is something that Amerigroup will send you, and it contains all of the information that you will need to reauthorize your participants. And so this way, if you are keeping track of all of your program participants in different slide sheets or spreadsheets, and you have documentation in various places on a drive, this is one centralized location for all of the information that you will need to submit for a reauthorization. Of course, if you have an electronic health record, it's sort of a moot issue because all that information is stored there, but this is a great opportunity for folks who do not necessarily have access to an EHR, who need to keep track of the details that you'll need to submit for reauth. All right, and with that, the plan for today, we will be reviewing Medicaid and FCS eligibility in Washington State, reviewing the process for enrolling your current and future clients in foundational community support services, and then, of course, consider how to ensure that your clients maintain Medicaid enrollment and FCS enrollment over the long term. One thing that's really critical that we love to drill in over and over and over again is that there's a big difference between Medicaid eligibility and Medicaid enrollment, just like there's a big difference between FCS eligibility and FCS enrollment. Just because someone may be eligible for Medicaid or for FCS does not necessarily mean that they are enrolled, and it's really important to keep track of who is eligible, who is enrolled, to make sure that they do not lose coverage. So, quick overview. Apple Health is Washington's Medicaid program. You may hear the term Apple Health thrown around. You may hear Medicaid. You may also hear medical assistance. That's another term for Medicaid. Apple Health is specifically Medicaid in Washington State. It's a public support program that will help low-income folks with medical expenses. You can qualify if you're disabled, blind, or aged. That's sort of a gold standard for Medicaid eligibility. But also, if you're lower income, if you're a pregnant mom or pregnant parent, or a family with children. And you can learn more about Washington State's Medicaid program, about Apple Health, at the Department for Social and Health Services. They do a really great job of making sign up as easy as possible. The state websites can help you find out how you or those you serve can sign up in person or by mail or online. It's really important to note that we're going through changes right now because of the public health emergency. When the federal government declared a public health emergency, the state suspended the process of so regularly, sort of annually processing re-eligibility and coverage. So this has been suspended. However, when the public health emergency ends, so when the federal government declares that COVID is no longer a public health emergency, or we're no longer in a state of a public health emergency, then the state of Washington will need to make sure that everyone still qualifies for Medicaid. Right now, the official public health emergency is in place until October 13th. That's in a couple of days. We will know sometime this week whether the federal government is thinking that they will extend. And the current thinking is that they probably will extend until the end of the year, though this has not been confirmed by HHS, by Health and Human Services. So it's really important that you watch your mail, that you educate your residents on why they need to respond to any notice they might receive about their coverage, about their eligibility and enrollment, because continuous coverage, as I mentioned, is extremely important for all healthcare needs, of course, but for this particular program, of course, for FCS services. But just to quickly finish up on this slide, the application is available online. You can apply in person or by mail or online, and you can access all of these links on the slide that we send to you. It's very easy. The state makes it very, very easy. And with that, I am going to turn it over to Jacob. He is with Amerigroup, and he's going to walk you through getting an authorization for your residents.
Good morning, everybody. So I didn't get a chance to introduce myself when our meeting started. My name is Jacob Avery, and I am the Quality Improvement Manager for the Foundational Community Supports Program at Amerigroup, Washington. And I'm going to talk to you a little bit about how to submit an assessment. And basically, that's the way we authorize services for FCS. We submit assessments, and after you submit the assessment, you're either going to get an authorization, you're going to get a denial, or we'll tell you you're missing some information. But I will talk about that soon. Next slide, please. So the reason I'm talking to you is because Amerigroup is currently contracted with the State of Washington Healthcare Authority as the third-party administrator for the Foundational Community Supports Program. So what that means is we do the administrative oversight. We determine eligibility for the program. That includes sending out service authorizations once someone's been deemed eligible, or denials, as the case may be. It also includes taking care of the billing after that, enrollment, disenrollment, and reconsiderations. But what we're going to talk about today is the enrollment process. This is basically goes from when you first see a client, potential enrollee, and getting them enrolled into the Foundational Community Supports Program, how to do that, and what it's going to look like. Next slide, please. So this is a little visualization of the whole process. Basically, once you meet with your potential enrollee, you're going to complete the assessment with them. We have versions. The assessment, in terms of sending it to us, the way to do it is to submit it online. But we also have copies you can print out. You may not always be in front of a computer when you're meeting with a client, and having a copy of the assessment might be helpful, depending where they are and what are the things you may be working with them on. It may take one or two meetings to complete the assessment form. The assessment's not particularly long. I think it's about 6 pages for housing and 4 pages for employment. Also, if you print out a copy, it'll show you what fields we absolutely have to have and what fields are optional. But you want to make sure we have at least all the required fields. Once you have that assessment form, you submit it online. And within 5 business days of you submitting that assessment, you're going to hear from us, either for an authorization or a denial, or if we don't have enough information or we can't find something, we'll let you know about that too. If you don't hear from us within 5 business days, that usually means something went wrong. So please reach out to us if you do not hear from us by that 6th business day. If we authorize, we will send you a determination. What that will look like is a secure email from Amerigroup, and it will have an Excel file, which will have the name, date of birth, ProviderOne ID number. It will also have the confirmation number you initially received when you submitted the assessment, and it will have the period of authorization if they are authorized for services. And I'll talk about this more a little later, but for FCS services, at this time, we always authorize in periods of 6 months, or exactly 180 days, about 6 months. And so we will start your period of authorization from whatever date you started your assessment, and we will end it 180 days later. Next slide, please. So basically, what you're going to complete the assessment. Once we receive the assessment, we need to determine if they're eligible for the program. So there's a couple criteria about whether they're eligible. One, they have to be actively enrolled in Medicaid. And that includes almost all kinds of Medicaid. There are a few exceptions, unfortunately. The exceptions are if they're receiving both Medicare and Medicaid, and they're enrolled in a Medicare savings program. That would mean they are, for example, qualified Medicare beneficiary. Basically, they would not be eligible in this case for any Medicaid-only services, and this would include FCS. Another exception is if they're currently eligible for both Medicare and Medicaid, but they're on a spend down. This means they make, quote unquote, too much money, and they need to pay out of pocket for services until their Medicaid is restored. The other exception is there are some Medicaid programs that the state pays for, 100%. Most Medicaid programs are paid for 50% by the federal government and 50% by the state, but there are some optional Medicaid programs that are paid for completely by the state. And those, just due to the terms of the 1115 Medicaid waiver that the state signed with the federal government, are not eligible for FCS services, which is unfortunate because some of those folks could certainly use services. But the vast majority of Medicaid is eligible for FCS services. And if you're wondering whether your particular client has a Medicaid, for Medicaid, which is eligible, I am going to put some links here a little bit later in the chat box. And we have some one-pagers where they will show you how to log on to ProviderOne, look up your client or potential enrollee, and make sure that their Medicaid is FCS eligible. And again, the vast majority of Medicaid benefit service packages are eligible for FCS services. In order to enroll in FCS supportive housing, your client needs to be at least 18 years of age. In order to enroll in FCS supported employment, they need to be at least 16 years old. The thinking behind this, I initially didn't understand why this was the case, but I asked one of the people who helped write up the proposal. The thinking behind this was that you generally need to be at least 18 years old to sign a lease, and at least 16 years old to get employment in the state of Washington. These age criteria may be changed at some point, but right now, this is what they are. And the other things you need to get enrolled for FCS services, you need one medical necessity or health need, and one risk factor. You can have as many, you can have multiple ones of these, but you need at least one of each. And I'm going to go over those in a little greater detail as we as we go on here. You'll notice on this slide, it also makes reference to the quick reference guide. That is on our provider website, along with basically all the documents I talked to you about today, including our online assessment form. I'm going to put that address in the chat box. And sometimes this can be a good thing just to look around, poke around on, because you can see our documentation. It'll have things about eligibility, how to get signed up for ProviderOne. It'll have printable copies of the assessment forms. Once you have everything on there, you will likely know a lot more about our program. And I'm going to put that in the chat box as we go on here. Next slide, please. So in terms of health needs, a lot of these are fairly similar for both supported employment, supportive housing. They're just a little bit different. Number one, for both services, and just to be clear, for those who don't have who have maybe a little less background on the FCS program, there are two core services. One is our FCS supported employment, which is to help find and maintain employment. And the other is FCS supportive housing, which is to assist in finding and maintaining housing. Both services have as a health need a mental health diagnosis or substance use disorder diagnosis. They also both share a potential health need. You need assistance with activities of daily living, 3 or more activities of daily living, or 1 or more hands-on activity of daily living. And this is something where it has to have been already assessed through the CARE assessment, the comprehensive assessment and reporting evaluation. And that is from ALSA, or Home and Community Services. They will make that assessment. And if an individual is, for example, seeing a behavioral health clinician, then they probably already have a mental health or substance use diagnosis. If they're already receiving in-home services from ALSA, it is likely they have met this criteria for activities of daily living. The other potential health need for housing is homeless with a disability. This means they are currently homeless, or they can have been housed for up to 60 days, but they were either currently or recently homeless, and they have a disability that could have been either from the homeless management information system, that could be from the disability administration. Anyone who has identified a potential disability, if they're receiving HEN, if they're receiving ABD, they should meet that disability criteria as far as we're concerned. Next slide, please. And here's the health needs for employment. And as you see, they're very, very similar. We have mental health, substance use, and activities of daily living. Only the last one's a little different, and that is if they are receiving HEN or ABD. HEN is, of course, housing and essential needs. It's a program where if you are not receiving any income, you can get some assistance in terms of paying for rent and also some hygiene supplies. ABD is also known as presumptive disability. Generally, you get a very small amount of money as they determine your disability, and if you are determined disabled, they will take that money away from your lump sum. But you used to only be able to get one of these at a time. Now you can get both. But if your client is enrolled in either of these and they're active on Medicaid, it's highly likely they'll qualify for FCS supported employment. And that is kind of an easy one, honestly. If you know someone is on HEN or ABD and they're interested in supported employment, you may just want to look up their Medicaid eligibility, because if they're interested in employment, they're very likely to qualify. Next slide, please. And next, I'm going to talk about the risk factors. So for supportive housing, a risk factor, so just to be clear, in order to qualify for FCS supportive housing services, you don't necessarily have to be homeless, but you can be. The service is both for housing search, but it's also for housing supports and maintaining current housing. If you are chronically homeless, the HUD definition of chronic homelessness, you will meet that risk factor. If you have been housed, but it's for 60 days or less, and before that you were chronically homeless, you're also going to meet the chronic homelessness risk factor. Next, we have frequent or lengthy institutional contacts. And what we mean by institutional contacts are admission to a nursing facility, a skilled nursing facility, a hospital, a psychiatric hospital, a correctional facility, either jail or prison generally, or an emergency room. So if your client has 2 emergency room visits in the last year, that's considered frequent. You just need 2 of these combined within the last year. In this case, lengthy means 90 days or more. So if you were incarcerated for 4 months, you're going to meet that criteria, for example. So frequent is 2 or more. Lengthy is 90 days or more. You have this is in the last year, basically in terms of total visits, they're all cumulative. So if you have 1 hospital stay and 1 ER visit, you have had frequent institutional contacts. Frequent adult residential care stays, that means you have been 2 times or more in a residential care facility. This could include an assisted living facility, an adult family home, a residential treatment facility, basically 2 or more in the last year. Frequent turnover in home caregivers means 3 or more paid caregivers in the past year. They do have to be paid, and generally what they're looking for, I think, is if paid usually through aging and long-term care. And finally, we have PRISM risk score. PRISM is an acronym for Predictive Risk Intelligence System, and it's a system maintained by DSHS. And basically what it is trying to determine is the risk of hospitalization for those who have claims through one of the government medical payment systems. So there's basically an algorithm that creates a certain score for everyone, and really what they're basing it on is claims. If you hit 1.5, that means that hits our risk factor. That's also the criteria for getting health home services, and you're also considered a person with a special health care need by the state of Washington if you hit that magic 1.5. The difficulty with this risk factor is that most of our providers don't actually have access to the PRISM system, so you don't know the score. If you have a client who you're concerned is not going to meet other eligibility and you're wondering about their PRISM score, I mean, you can send in, you can submit the assessment anyway. We'll always check PRISM score for anyone you submit, and automatically give them that eligibility if they meet that 1.55 PRISM score or higher. Or you can actually reach out to your FCS manager, or if you don't know your FCS manager, please just email fcstpa@amerigroup.com and we can connect you to them. And if you're just wondering if your client is going to meet that 1.5 PRISM score, we should be able to look that up for you if you don't have access to the PRISM system. It's a little unfortunate just because this is one of the criteria, and of course, it would be easier if our providers knew if their clients met this criteria or not. But if you don't, please reach out to us and we can try to get that information for you. Next slide, please. And please keep in mind that basically the way we determine eligibility is we're always going to try to find whatever we can. We would like you to mark why you think they're eligible, but how we train folks who do the determinations is to always look for every potential way they could be eligible for FCS services. So even things you do not check, we will check on for you. And if they meet those criteria, we will, with the records that we have access to, we will give you credit for that. We will get them enrolled for you. We want to use all of our resources that we have access to try to get folks who we believe are eligible enrolled. Finally, I'm going to go over the risk factors for FCS supported employment. These are a little easier, I would say, than the FCS supportive housing. We have risk of deterioration for mental illness or substance use and dysfunction in role performance. You can check these if you feel there is a risk of deterioration that meets the definition in the box, or if you feel they have a dysfunction in role performance. Basically, if they have a mental health or substance use diagnosis and you feel they meet these other criteria, you can check them and we will get them enrolled. This is really, your opinion as the clinician. If they have 2 or more episodes of residential or inpatient substance abuse treatment in the past 2 years, they're also going to meet that risk factor. If they have a care assessment, that means basically if they're receiving ALSA services at all, they will also meet the risk factor. Or if they're receiving HEN and ABD, you're going to meet both the health need and the risk factor just by getting HEN or ABD. So in general, it's usually a little easier to meet the risk factors for supported employment, just I think due to the way it's written. So I know I'm going over these quickly. We have more information on our website, but if you find yourself doing the assessment and getting confused, not being sure how your client's going to qualify, not sure if they're going to meet any specific criteria, please reach out to your FCS manager, and they can walk you through it. Like any process, it takes some time to get used to the criteria we're looking for, submitting the assessment, getting the authorization. So yeah, especially when you're beginning, don't feel free to reach out to us and we can assist you, make sure what you're giving us more or less what we're expecting, and we can try to get your folks authorized. Next slide, please. One of the things we will want on your assessment form is the ProviderOne number, or the medical. You also may see this called a State of Washington Medical Service Card. Basically, it's your Medicaid card. It's kind of a blue-green card you will get from the State of Washington, and it will have what we call the ProviderOne number. It is a 9-digit number followed by WA. And that is the ID we generally use for the FCS program. This is also the ID for this particular program that I use to bill on. The reason is because we include we serve all FCS clients. So whatever their Medicaid managed care organization is, we're the TPA in terms of their FCS services. So we don't need their MCO identification number, but we do want to get their ProviderOne ID because that's something that shouldn't change. You can look, if they have lost this card, you can often look up the ProviderOne ID if you have the first name, last name, and date of birth. We have a guide about how to get ProviderOne access. Once you have it, we also have a guide about how to look up client eligibility on ProviderOne. The great thing about having ProviderOne access, you can make sure their Medicaid's eligible, you can make sure they have FCS eligible Medicaid, and we recommend you check that at least once a month. Usually, because the state's not actively disenrolling folks now because of the COVID emergency, the odds are they're probably going to be Medicaid eligible, but I would recommend checking on the first of the month anyway. Sometimes that's the most likely time things are going to change unless your client is incarcerated or goes to a state hospital. They will have their Medicaid suspended while they are incarcerated or in the hospital in that case. Again, these hyperlinks you see on the slide here, if we send out a PDF version of this, those should be clickable. But all these documents are in the at the address I put in the chat box. Next slide, please. So to submit the assessment form, you're going to want to go to that that link I put in the chat box, and you look under assessments. Basically, there are two links there. One is for online supportive housing assessment, and one is for online supported employment assessment. We also have printable PDF copies of the assessment, both in English and Spanish. We used to accept printed copies that were faxed or emailed to us, but we would like you to submit those online now. The reason for that is you submit them online, they go directly to our database. It's much easier for us to get them from there and back to you. If it has not done so far, it's going to improve our turnaround time, and we are going to have all the information in a more centralized place, and we're also much less likely to lose anything. Obviously, we don't want to lose anything, and this way we have all the assessments going to the same place, and you should get a confirmation number once you submit it. So if you go and click those links under assessments, it'll take you to our online assessment form, and that is where you're going to want to submit your potential client's information. These are both secure. They're encrypted 2 ways. I would tell you the technical specifications, but I do not honestly know them. But if you're interested, I can get that from our tech folks. Next slide, please. So yeah, as I said, really this is the way to get your clients authorized for FCS services. We have the link there that you'll want to submit the assessment forms. You want to make sure you can complete all the required fields. That includes name. Try to make sure you're spelling the name correctly. Correct date of birth, ProviderOne ID number. You want to have at least 1 health need and 1 risk factor. And with the online form, it won't actually let you go on unless you check at least 1 of each. So it's likely once you submit it, you will have at least 1. And the client signature. And in this case, we recommend that if you're doing the assessment face-to-face, you get the client signature in real life and can have it on file. Because we are doing this online, we don't have an online signature. We just generally request you have a verbal confirmation that there's a signature. During the period of the COVID emergency, you can get you can do the assessment on the phone and just get verbal confirmation. You know, the best practice is definitely to have a physical signature when you do see them in person, but we understand sometimes, especially during the pandemic, it is easier to conduct the assessment by phone. Yeah, and the good thing about the online assessment, if you don't complete the required fields, it actually won't let you submit it. So it's a good way to make sure you've completed everything. Please make sure you submit these within 10 business days of completing the assessment. If it is older than 10 business days, it won't let you submit it online. If something just got missed, if it's, you know, please reach out to your FCS manager and we can see if we can help. Next slide, please. And this is actually true both on our forms and on our website. If there's a little asterisk next to the box, that means it's a required field. Once the page without filling in a required field, it will turn red and it won't let you go any further. So you'll want to make sure you complete those. Things like first name, last name, date of birth, the date the assessment was completed, and the ProviderOne number. You'll also see at the top there, initial assessment or reauthorization. So if this is the first time you're ever submitting a assessment for a particular enrollee, or if you've tried to submit it before and for whatever reason it was denied, you can mark initial assessment. If they have already been enrolled and you've been working with them for some time, you can do reauthorization. This is something, honestly, we're going to check either way, but it is helpful for us if we know it's a reauthorization. When we say reauthorization, what that means is we have already enrolled them in the program before. So basically our periods of authorization are always exactly 180 days long. To reauthorize, you just submit a new assessment form 4 to 6 weeks before the current period of authorization expires. It could be later than that, but we recommend you do it. We will send you a notification once you can start turning those in, and we recommend you do it a little early if possible. We will automatically make sure they get credit for whatever health need or risk factor they initially qualified under. So if they were initially chronically homeless, but for example, you help them find housing and they're not homeless anymore, you can still use that chronic homelessness risk factor. Basically, we want to make sure that supports are available to all FCS enrollees, even if they no longer meet those initial criteria. So basically, once you're enrolled in FCS, when you're doing a reauthorization, the only reason you should get denied is because your Medicaid isn't eligible. You can just use the initial risk factor and the initial health need, and we should give you credit for those. Next slide, please. So we have a number of sources of data that we use to validate eligibility. We have some de-identified ProviderOne numbers that tell us if someone's enrolled with receiving ALTA services, if someone is chronically homeless, according to one list anyway, if someone has a PRISM score of 1.5 or higher, and a number of other things. We also have access to the state's PRISM system, so we can check PRISM scores, see if they have mental health diagnoses, but we don't necessarily have everything. If you're concerned that we're not going to be able to authorize services, you can send additional supporting documentation. Now, you don't have to. Most of our assessments that come in do not have supporting documentation, but it can be helpful. We're going to ask you whether you're going to send it in or not. If you say yes, basically that means we will look for it. We ask that you send it in the same day you send in the assessment. That way, we're going to have a much larger chance of finding it. Ideally, we would be able to submit it in the electronic assessment form. The electronic assessment form cannot do that right now, unfortunately. So we do have an email address you can submit that to. That is fcstpa@amerigroup.com. We also have a fax number that will be available later. I will put that in the chat box. You can send that to. Whether you send it by fax or email, it will go into our email box, and we will. You can also, when you put that additional documentation, if you put the client's name or the confirmation number, that's incredibly helpful for us. We can talk a little bit about what documentation might be helpful for us. You see that fax number. I'm going to put in the chat box, but it's also on this slide. But just really what we're just going to want to see is yes or no. If you put no, then we are less likely to. We will not look for that additional documentation. We will just use the resources we have. I will say that it is definitely helpful to get supplemental documentation, but that, again, most of our assessments don't actually have it. We can often authorize folks without additional documentation. Next slide, please. So I'm going to talk about a few examples of documentation you might send over. One is for chronic homelessness, we have a list of folks that the state believes are chronically homeless, but we know for a fact that there are a lot of individuals who are not on that list who may be experiencing chronic homelessness. Folks who are homeless don't always report it, and even if they report it, it may be reported to a place where we at Amerigroup don't have that information. To solve this issue, we have an attestation form, a chronic homelessness attestation form that is on that same website that I have put in the chat box. Either if you are their clinician and they meet chronic homelessness eligibility, you've worked with them for a year and they've been homeless the entire time, you can sign that yourself. If you do not know it yourself, but they're willing to sign it, they can also sign that attestation form, and they can say, yes, I'm chronically homeless, and we can accept that. So this can be a great way to get eligibility through chronic homelessness for folks who maybe don't have that paper trail. And we know they don't always have it, particularly for homelessness, because it's just the data is incomplete at best. Also, some other documentation that we commonly get, we often can validate a diagnosis of a mental health or substance use disorder, but sometimes we don't have it. Sometimes they may have gotten treatment in other states. They may have gotten treatment at the VA or under private insurance, and it just doesn't show up in the state system. Any medical records you could give us with showing they're receiving mental health or substance use services, or they have a diagnosis, we can use any of those, and we will give you credit for those health needs. Also, if you have a coordinated entry assessment showing that folks meet the definition of chronic homelessness, or that they have a disability per the homeless management information system, we don't always have access to that. Those are generally done within particular counties. If you do, and you can get that to us, that's incredibly helpful in terms of determining homelessness. As I said before, you can send those via secure email or fax. We recommend that the subject of your email is supporting docs, and if you have a confirmation number, which you should get after submitting the assessment, it is incredibly helpful to put that confirmation number in the subject line. If you've forgotten it or you don't have that, just send the supporting documents, and we will still be able to search for it. But any additional information you can give us is always helpful, just so we can match it back to the assessment you submitted online. Next slide, please. And again, I just want to say, yeah, if you do have supporting documentation, please send it the same day as you submit your assessment form. That makes it much easier for us to find. Again, any more information you can give us, the easier it is to match up. So if you have your confirmation number, if you have your agency name, very helpful. And we also would like to get the enrollee's name and ProviderOne ID. Those are all ideal. Again, if you're sending a form in, it's probably going to have the name on it. It's probably going to have at least the potential enrollee's name on it, and hopefully their date of birth, ProviderOne ID, something like that. But again, anything you can do to help us make sure we're getting the right person is helpful. Next slide, please. So once you've completed the entire assessment online, you will get to our final screen, and it will say submit, and next to that it will say print assessment. So before you submit, you'll want to click print assessment. I've submitted these online, and it is very tempting just to press submit, but you will want to print the assessment first. Once the print screen comes up, generally you'll have the option to save to PDF, or you can actually print out a copy too if you like. If you save to PDF, you will have an electronic copy of everything you submitted. It'll include the confirmation number and all the details. You can also print out a copy and save it with your records. That way that if we ever ask, when do you submit this, what was the confirmation number, you can just look in the client's records and reference that for us. Once you print or save or both, you can click submit. Next slide, please. Once you click submit, you will get a confirmation number. Here it's 4 digits. Generally, I think they're 5 digits now, actually. Now, the document that you printed out before actually will not include that confirmation number. So I reckon what I do when I've done this, in test copies of this is I just write the confirmation number. If I printed it out, or I will put that confirmation somewhere else just so I know it. It's great to have the confirmation number. That way you can, if you don't get anything back from Amerigroup, one of the things we'll ask you is what your confirmation number was. That's one great way we can search for it. Again, if you don't know, we should be able to search by name and all that as well. But the confirmation number is a great way to know that at least it got through our submission process. Next slide. And again, you should hear from us within 5 business days. If you don't hear from us within 5 business days, feel free to call us immediately on that 6th, because that means something's gone wrong. You should get a secure email, and you should either get an authorization or a denial. The other thing you might get is a rejection. What a rejection is if they are enrolled with another provider, we will say we're rejecting this because they're already enrolled. If they are enrolled with another provider, but they want to work with you, you can just send us a provider change form at that point. When you look up eligibility in ProviderOne, you should be able to see if they're already enrolled, but sometimes it's a little difficult, to be honest. So, or they could have just gotten enrolled and it may not even be visible in ProviderOne. So it is possible that they look like they were not enrolled, but they actually are. That's unlikely, but it could happen. If they're authorized, the other reason we would reject is if we just couldn't find the ProviderOne number, or the name, or the date of birth was wrong. We would just ask you to correct that information and resubmit. If you get an authorization, you will get an Excel spreadsheet and a secure email. It'll tell you the periods of authorization. It should be exactly 180 days in length. It should start with the day that is on you, that you submitted that you began the assessment, and it should end 180 days later. If you're doing a reauthorization, your period of reauthorization will also be exactly 180 days long, and it will start the day after the previous period of authorization ended, assuming you're submitting this before it expires. If suppose the person maybe went away for a couple months, their period of authorization expired, but they've already been enrolled in FCS, they come back to you, they want to get re-enrolled, so you send us a new assessment. You could still say reauthorization. We would give them credit for the criteria they already qualified for, but their new period of authorization would start whatever day you began the assessment, because their old period of authorization already expired. Next slide, please. Yeah, if you get a denial, you will also get a secure email. It will include an Excel spreadsheet, and will include why this particular assessment was denied. Generally, we're only going to deny for 2 reasons. One has to do with eligibility. For example, their Medicaid was inactive, or it was suspended because they're incarcerated, or for example, they're on a spend down, or on a kind of Medicaid that is not FCS eligible. The other reason will be that we were not able to validate either the health need or the risk factor. And we'll tell you which one we couldn't validate. And generally, we will request additional documentation at that time. If anything we say is confusing, please reach out to us. You can call, you can email fcstpa@amerigroup.com, or you can email your FCS manager and they can give you some immediate assistance. If you have additional documentation, you can send that in to us via our email or fax it in. It's great if you can also use your 5-digit assessment confirmation ID. That way we know what assessment it's going with. If it's been a while, if you request those forms, you can just resubmit the whole assessment online and include that documentation via email, and we will get that for you. If there's any confusion, though, please reach out to your FCS manager, and we can make sure it's we're getting the documentation we need and that there's no confusion about the assessment. This is particularly folks who are just starting. We want to make sure we're getting folks who qualify enrolled. The other reason we might reject things is if the ProviderOne number is wrong, or the date of birth is wrong, or the date of birth and the name and the ProviderOne don't match. Then we just can't determine who the individual is. So we'll just ask you to resubmit that with the correct information. If you need help finding that, we can look in P1 for that for you too. Either way, you should get an explanation in your email. Next slide, please. So I throw around the words denied and rejected. Those sound really similar to me in terms of everyday usage. When we mean rejected, we mean we didn't do a determination of eligibility yet, just because we're unsure of who the person is or they're already enrolled. So we basically, if we didn't get the appropriate information, we're just going to ask for the information again, just to make sure we're getting it correctly. If they're already enrolled, you can just send us a provider change form. And if the individual wants to be with a new provider, then we can get them over to you. If they've been denied, that means we have received, we believe we know who they are. The assessment was completely submitted appropriately, but we were unable to validate the client's eligibility, either due to Medicaid status, or we couldn't validate either the health need or the risk factor. Next slide, please. And again, if you haven't heard from us after 5 business days, you can call us at our FCS call center, 844-451-2828. You can email us at fcstpa@amerigroup.com. You can also email your FCS manager if you need to. If you have your assessment ID, that's always very helpful for us. Do try to keep a record of that if you can. Please try to make sure you're keeping track of the authorizations, rejections, and denials. You should get that Excel spreadsheet if you get either an authorization or a denial. So you can keep that in a place either connected to the client's file, or you can add that to a spreadsheet you're maintaining. We just want to make sure that you're aware of the current status. If you ever do get confused, please reach out to your FCS manager, and we should be able to give you a list of all the clients who are currently enrolled, recent denials, recent authorizations. That should be possible for us to send over to you. Next slide, please. You can always request a reconsideration if we denied something too. Usually we will request additional documentation. So for example, if we weren't able to find a mental health diagnosis just because one was not available on the tools we have access to, what we're looking for is some kind of letter from a mental health clinician or a substance use disorder clinician saying the person's receiving treatment or that they have a diagnosis. If they're homeless with a disability, a coordinated entry can often tell us that. Also, for example, if they're receiving ABD and maybe they just got that and we don't see it in our system yet, you can send that to us. You can send the award letter over to us. If they have frequent or lengthy institutional or residential contacts, we can usually find those, but some things for some reason, sometimes we can't. So, for example, it happened in another state, if it was through the VA system, sometimes if it was very recent, we might have access to it. If you have a copy of a medical record, oh, look, they're in the hospital for 5 months, you know, that can be very helpful to us as well. Next slide, please. And as I said, chronic homelessness is one risk factor that you know, we know a lot of our clients may qualify for, but we may not have that information in our system. Keep in mind, we do have that attestation form available on our website. Also keep in mind that they can have been housed for up to 60 days after that period of chronic homelessness. So if they just got into a new apartment, but they were chronically homeless before that, we should be able to get them eligible too. Next slide, please. I think we're going the wrong way here. Here we go. Keep in mind, so the period of authorization is always exactly 180 days long. Can we go back one slide? But we will always initially authorize the same amount of units. For supportive housing, we will always authorize 30 per diem units. Because it's a per diem unit, you can bill 1 a day, no more. We recommend we recommend about 60 minutes of services, but it can be as little as 15 minutes. That can be as long as, I guess, the whole day if you wanted to, although that probably wouldn't be the most efficient way to provide services. And for supported employment, we will always initially authorize 120 units. In this case, each unit is 15 minutes of services. They both boil down to approximately 30 hours. And they're just divided out a little differently the way they get billed. And this difference is really just because they were looking for ICD-10 codes that already existed, and for supportive housing, they had a choice of either per diem or monthly rates, and they chose the per diem. We recommend it, especially if you're just starting FCS services. It can be helpful to speak with our supportive housing trainers at DBHR. Right now, that's Kimberly Castle and Rayanne Orbum, although they're likely going to get some great new folks to start helping with that. They may be able to give you some tips on how to build those and how to structure those meetings. You can reach out to your FCS manager on it too, because they're obviously slightly different in the way they bill, but they're kind of written to be approximately the same amount of time. Again, you will every month we will send out notification, and if you have clients that have been enrolled and are within a month, or actually probably about 2 months of expiring, you will get a notification from us. We will tell you you can submit their reauthorization now, and all you need to do is submit a new assessment for them using current information on our website. Ideally you would send that in 2 to 4 weeks prior to the authorization expiration date. But you could send it the day before, but we would rather get that to you early so we know there's no gap between the periods of authorization. When you resubmit that, you go into our website, submit it just the same way. You just want to make sure you're marking reauthorization instead of initial authorization. That way we know we're looking for the period of authorization expiring, and we're going to give you credit for the health need or risk factor that they've already qualified for. Next slide, please. So in order to be actively enrolled in FCS, we want to make sure that the Medicaid stays eligible. They've been authorized by Amerigroup, and once they've been authorized by Amerigroup, that eligibility goes into ProviderOne as well. If you go into ProviderOne under the Managed Care section, you should see Amerigroup Housing, Amerigroup Employment, or Amerigroup Housing and Employment. It should show you the dates where they are eligible. There's also in ProviderOne an FCS section. That tends to be not accurate, though. We don't recommend you look there. What you're going to want to look under Managed Care Organization. You can always check eligibility in ProviderOne. After you initially get someone authorized, it can take up to 3 weeks to get into ProviderOne. We also ask that you don't bill for those first 3 weeks. So, the reason is we send the eligibility over to the healthcare authority. The healthcare authority sends it to ProviderOne, and then ProviderOne sends it back to our claims system. If you submit it too early, the information will not be in our claim system yet. It has the potential of getting inappropriately denied or rejected. If it is denied, just let us know and we'll reprocess it. But we don't, ideally we want you to get paid the first time you bill for something, obviously. Once they are in our system, you can bill anytime. There's a timely filing of, we'll talk about claims at a future training more, but timely filing is 365 days, so you have up to a year to bill. Next slide, please. So again, you'll want to make sure you're checking at Medicaid eligibility and enrollment status. Ideally, of course, it would be great to check Medicaid eligibility every time you provide services. That might be possible if you're in an office and you have easy access to ProviderOne. Sometimes that might be tricky, obviously, if you're doing a lot of services in the field. I would recommend at least checking once per month on the first of the month. That's usually when your eligibility is going to change. We do have step-by-step guides on our provider website on how to check that eligibility. There should be, when the PDF version of this goes out, there should be hyperlinks to those specific documents, but they're all on that website that I put in the chat box as well. If for whatever reason, when you go into ProviderOne, you see something looks weird in terms of their FCS eligibility, feel free to reach out to us. There are sometimes mistakes on the state system, and we work really hard to try to identify those. But if for whatever reason you see one and they should be eligible and they're not, we can reach out to the state and make sure that's fixed. Reach out. Your FCS manager is the best person to reach out to about that. Weekly we will notify the HCA if there's any eligibility mismatches between what we believe and what we found on ProviderOne. Next slide, please. So again, you'll get your service authorizations. They will be Excel spreadsheets. We will send an enrollment report to the HCA every week. And again, there's that 3-week delay period between us sending you the authorization and the client authorization being fully loaded into ProviderOne and available to submit claims for. There is also a tool available in Availity. For those who don't know what Availity is, it is one of the clearinghouses that are used to submit medical claims. Our billing guides generally use Availity as an example because it's free for our providers to use to submit professional claims on it. There is an eligibility and benefits inquiry in Availity that can also be used to check client eligibility in FCS enrollment. You can use this if you don't have access to ProviderOne, but ProviderOne is ultimately the source of truth, and it is what I would recommend if you do have access to ProviderOne. If you don't have access to ProviderOne, also please request it. If you're having any trouble getting it with the healthcare authority, please let us know, and we can just let them know, just to make sure, because we would like all our providers to have that. It seems really essential that you can check your client's eligibility using that tool. Next slide, please. There's another tool available on Availity. It is called Remittance Inquiry. That is a place to check payments, remittances that have come through from Amerigroup. It is its own little app in the Availity system. If basically when you submit claims, if you are set up for electronic fund transfers or direct deposits, you are going to receive sort of the explanation of payments via Availity. Those should be available via the remittance inquiry tool. If you're not set up for that, you should get a paper copy of the explanation of payments when you receive your check. To sign up for those electronic payments, the benefit of this is there's no worry of losing the check, and you'll get your funds sooner. They get deposited into your bank via ACH, and it's generally a quicker process than receiving a check by mail. The way to sign up for that is through a tool called EnrollSafe. There is a address on the slide you see in front of you. It's enrollsafe.payehub.org. They also have a phone number you can call. That is currently the way to sign up for those electronic fund transfers. Yeah, this I hear signing up through EnrollSafe. We used to have a different tool to use that, and I heard it took a little time. This one apparently is better, is what I've heard. I have never actually tried, so but if you have any difficulty again getting signed up for EFT, please let me know, and or your FCS manager, and we can try to assist with that as well. Definitely want to make sure you're getting paid. Next slide, please. So this is our contact information at Amerigroup. I've talked a long time. I would understand if you didn't remember absolutely everything I said. We will send out these slides, but if you have additional questions, please feel free to reach out to us. We want to make sure that you are able to provide services and get your folks enrolled and bill appropriately. On the left here, you see our team shared inbox, fcstpa@amerigroup.com, our FCS call center, and our FCS shared fax number. You'll also have another link to that provider website. And on the right, you'll have our FCS, you'll see our FCS managers. Those are currently Ali LaFontaine, Brandon Knudsen, Connor Chin. Our special programs manager, Lisa Lawrence, and I'm the quality improvement manager. My name is Jacob Avery. Your FCS manager may also still be our TAP manager, who is named Joe Elder. He is also doing our transition assistance program at this time. Feel free to reach out to us either at our shared inbox or individually if one of us is your FCS manager. If you're not sure who your FCS manager is, reach out to our inbox and we can find them for you. And I think that's it for me. I know I've talked for a long time. I'll turn it over to you.
Thank you so much, Jacob. This was extremely helpful. Before we move on, I just want to offer the opportunity for folks to ask any questions of Jacob. Feel free to unmute yourselves. Turn your cameras on if you would like. You can also add questions to the chat, but just want to allow that opportunity since I know that a lot of information was just covered. All right, well, as Jacob mentioned, if you guys have other questions, feel free to reach out to him directly. And we just have a few more slides to get through. I know we're ahead of schedule, so again, don't hesitate to reach out with any questions that you have. We can also leave a few minutes at the end. So just to quickly give you a bit of an overview about how many of you are involved in FCS, there's been a growing provider network that's being built across the state, which is really exciting. As you can see, there's folks all over the state. Last session, we had each of you put your cursor on the map to show us, or annotate the map to show us where you're all coming from. So obviously there's a big concentration in the Seattle area, but there's great representation all across the map. To date, there are 172 contracted FCS providers offering services in just under 500 locations. And currently there's more than 9,000 individuals receiving supported employment and supportive housing services. 2,557 people are enrolled in supported employment and 5,559 are enrolled in supportive housing. A little more than 1,500 are enrolled in both. And to date, more than 26,000 unique individuals have received FCS services. So this is a huge benefit to so many folks across the state. It's really an amazing program, and we're so excited that you guys will get to participate in this and benefit from these funds. So essentially what we want to reinforce is that if it's not, if it's not broken, don't fix it, of course. So the goal is really for as limited a disruption as possible as you transition to billing FCS for the supported employment or supportive housing services that you're providing. We don't want there to be a disruption for your residents. We don't want there to be a disruption for your staff or for yourself. The steps that Jacob clearly laid out will really help you to avoid any kind of service disruption, making sure that you stay on top of reauthorization, making sure that you stay on top of announcements like when the public health emergency is going to end and your participants are going to be, or your residents are going to be up for eligibility determination or enrollment determination. All of that is so key to stay on top of, to make sure that no one loses coverage for their healthcare, for their supportive housing, for their supported employment. Next session, we're going to talk a lot more about time studies and billing. We'll be sharing slides to, ahead of time to give you a sense of what we'll be covering. We'll also be sharing some budgeting tools. But what we'd love for you to be able to do is use the tools that we've shared, including the eligibility tracker that we share in this session, to get a sense of which of your residents are eligible, who's not eligible, how many, and why. Start thinking about which of your staff will be designated FCS staff and will be actually billing for services. We also really want to encourage you to think about which staff, what those staff are doing, and ensure that what the staff are doing are billable activities under FCS. And using the budgeting tool that we'll be sending out to you, start to develop some preliminary revenue projections. As I mentioned, up next, we'll be talking about staffing and budgeting. So thinking about the role that your staff will play, the responsibilities they'll have, making sure that those activities are billable under FCS. That will take place next Tuesday at 9:30 Pacific time. And then, as I mentioned, on Thursday, October 20th, so the Thursday following that next session, we will provide an opportunity for Q&A. We really encourage you guys to take advantage of this session. It's just going to be an open conversation where we'll be there to provide any support or technical assistance, answer any questions about any of the material that you've been struggling with. So just to plan ahead for session 3, It would be great if you could, like I mentioned, take advantage of the tools that we'll be sharing. Think about and try to access your staff salaries for your direct service staff, as well as for your middle managers, your supervisors, and your quality improvement staff. This will be really helpful as we work on your budgeting projections tool. Also, make sure to access your program budgets, and that includes the operating costs for your organization. That includes office rent, utilities, technology, and any OTPS expenses as well. And that is the end of session 2. I'm going to stop sharing my screen, allow us to all see each other, and feel free to turn off your mics, or turn on your mics, that is, if you have other questions for us before we close out for the day. John, I see that you're raising a hand. Feel free to come off mute.
Hi, everybody. I had a quick question about the initial enrollment and using a behavioral health assessment in the event that the initial enrollment is rejected. You also stated that a coordinated entry assessment could also be used, and I'm wondering, is that either or, like either a behavioral health assessment or the coordinated entry assessment could work, or does it have to be both?
So a lot of times a coordinated entry assessment will see, will identify like a disability related to mental health. And I realize, of course, in reality, sometimes this is just asking them. But my understanding is we can use that to determine a health need for mental health. So yeah, if you have a coordinated entry assessment that indicates a mental health need, you could use it for that. You could also use a coordinated entry assessment. Obviously, it's most helpful for determining chronic homelessness sometimes, because we don't always have that correct information. So if you have access to the coordinated entry assessment, yeah, we will try to use it to identify any eligibility that would be relevant to the program.
And we can just pull those off of HMIS ourselves and submit them?
Yeah, if you have access to HMIS, I know not every agency does, but if you are one of the lucky agencies that does, yeah, that's super helpful for us. Unfortunately, yeah, we don't generally have access to county HMIS systems.
Thank you.
Any other questions, folks? All right. Well, I know that Jacob was extremely thorough. Thank you so much for your time, Jacob. And thank you to everyone who joined this training. We're really excited to join you again next week. And in the meantime, if you have any questions, don't hesitate to reach out to me, to Jacob. Again, if you don't receive an email from CSH, from the IT director, Josh Rucker, or Microsoft asking you to create a password to join the CSH directory, please let me know if you don't receive an email like this by end of day tomorrow. My goal is to get you all access to the SharePoint drive by tomorrow afternoon. So it'd be great if any of you are missing that access. I want to make sure as soon as possible. Thank you all again.
Ava, there's a question in the chat about if somebody doesn't have a Microsoft business account. I think we should figure out how to work around that. It sounds like if someone doesn't have a Microsoft business account, they can't access the chat. Is that, I mean, they can't access them as SharePoint materials. Is that correct? I don't know.
You can access it from any email. It doesn't require a Microsoft business account.
Interesting, because I tried signing into that and it said without a Microsoft business account, because I have a personal one, but didn't allow any of that to work. So I was just wondering, yeah, if the link could be sent out again, I can give it another go.
Well, and
Yeah,
let us check
what I
back with
would
our IT
recommend-
director, Eva.
Well,
Yeah.
I was going to say, what I would recommend is if you respond to the IT director directly and copy me and say you've tried to access it and this is the issue that you're having. Another participant in the training had a similar issue and emailed Josh directly, copying me, and he was able to help her. So that would be my suggestion.
Sounds good. Thank you.
All right, everyone. Thank you so much. Have a great rest of your day, and we'll see you next week.
See you next week, everybody.
Thanks, everybody. Have a great day.